Hello everyone, my name is Manasnet Klinkul. I am a registered nurse working at Atrium Health Hospital in Charlotte, North Carolina. I am also pursuing my Master of Science in Nursing Education at Mount Mercy University. Today I'm going to be presenting my professional practicum teaching at South Piedmont Community College in Monroe, North Carolina. I did my practicum teaching at South Piedmont Community College in Monroe, North Carolina. My preceptor is the director of nursing, so she gave me a chance to participate in teaching both on and off campus. The first lectures that I gave is the male GU dysfunction. I did review the course objectives, present my lectures, and also implement some active learning strategy to gain more class participation. I did some research about the evidence-based literature about how to teach the active learning methodologies, and it shows that active learning methodologies place students at the heart of the learning process, favor critical thinking and ability to make decisions. The next lecture that I gave is regarding to the supplemental oxygen. This class I gave the lectures to the ADN program. I did develop the PowerPoint presentation and presented about the oxygenation concept, including oxygenation, ventilation, diffusion, and perfusion. I explain and demonstrate how to use each oxygenation delivery device, such as nasal cannula, face mask, partial rebreather mask, and non-rebreather mask, and also ventilator mask. I also did explain about the oxygenation flow rate and the purpose of each device. In this class, I implement the short scenarios to help students differentiate the cause of hypoxemia and hypoxia. The class scenario helps emphasize the nursing concept. It helps improve the clinical reasoning and also helps students find the appropriate nursing intervention to each scenario. The conceptual models of nursing provides a unique body of knowledge that can be used to guide construction of case studies and enhance applications of didactic course content to nursing practice. The last lecture that I presented was in regard to the acid-base balance or the ABG interpretation. This class was given to the nursing student in the ADN program. In this class, I presented the lectures about the acid-base balance, including pathophysiology, clinical presentation, and nursing intervention. The tic-tac-toe technique was introduced to the student to exemplify the ABG interpretation. But because ABG is very complicated, so I implemented the case studies using group activity, which allows students to practice on the ABG analysis. These short scenarios or the case study, it's help illustrate clinical manifestation, allows students to detect the ABG change before seeing the lab values. This helps the student to focus on treating the abnormal values, which is desired outcome of interpreting the ABG. I also did some clinicals at Atrium Health Union, which is my hospital that I used to work at. This clinical was on the medical surgical telemetry unit, and the student that went to the clinical is the ADN first semester student. In this clinical, I introduced the nursing student to the unit and explained about the patient's population on this unit. I showed the student the storage room, the nourishment room, the clean and dirty supply room. I demonstrate how to use Epic, Omnicell, Crash Card, and also participate in the pre-conference and post-conference. I did discuss with the student regarding the cardiac patient's presentation and also intervention. During clinical, I also assist the nursing student during patient's assessment and medication administration. Apart from the clinicals, I also did some simulation lab um, on campus with both LDN and the ADN program. In the simulation, I participate in a whole day simulation experience with the LDN and ADN nursing students. I review the scenario about the end of life communication scenario and the heart failure scenarios. I led 3 end of life communication simulation scenario, including the DNR discussion scenario, fear of death scenario, and communication with family scenario. I did the pre-briefing and debriefing for each communication scenario. Also, I assisted in the heart failure high fidelity simulation. In this simulation, we use the mannequin, which is the high fidelity simulation mannequin. I set up the mannequin, I set up the medication card and the nursing supply. Also, I work with the mannequin software to stimulate the heart failure scenario. At the end of the scenario, the students gave me some feedback about the latest simulation and recommendation for improvement. On campus, we also did some nursing lab, which is like, for example, the skill check off. In this nursing lab, I did participate in the students' skill check off for female urinary catheters insertion, and also the student has to show us how they teach the patient. So I observe when they teach the patient and also provide some recommendation. Some nursing lab has we work with some supplies. For example, I taught the student how to use oxygenation tubing, how to insert NG tube, G tube feeding, and how to use the feeding pump, as well as the stomach care. Also, in the lab, I teach students how to perform neuro assessment as well. And that would be it for my clinical practicum. If you have any question, you can reach out to me at my Mount Mercy University email address. Thank you very much for your attention. And this is my reference for my evidence-based practice.